So basically, you are not just treating the symptoms, but you are treating why it has happened to the person.
Yes. And we understand that it is one condition can present as multiple disorders, and multiple disorders can drive one condition too. But I think mindfulness is something that has changed my life significantly.
So if there's one hack for wellness that you could put it on a billboard, what would that be?
My refrigerator at home looks like any refrigerator. I have children.
If you're curious about ways to improve your health that go beyond traditional medicine, functional medicine might be the answer. So let's explore the science, stories, and strategies behind functional medicine in our today's episode. Welcome to the program, Doctor, and it's so good to have you.
Thank you so much for having me here, Dr. Lakshmi.
So, Doctor, share us some insights about your medical journey and what made you choose this path.
I've always been passionate about being a physician. So when I was 5 years old, also, if somebody would ask me what I'm going to be, I would say I would be a physician. So that's been my passion throughout my life. I'm an MD in internal medicine. And then I've done a certification from the US in functional medicine from the Institute of Functional Medicine.
So what exactly do we mean by functional medicine? I mean, we get to hear a lot about functional medicine, I'm sure, these days.
That's true. I think functional medicine has become a buzzword that everybody wants to get on the bandwagon for. So when you look up functional medicine online, right, there's a lot of complex words that come in, root cause based medicine, systems biology, omics biology, then personalized precision medicine. But to put it simply, so people understand, it's asking the why and how you have these chronic disorders. Why, that is going into the pathophysiology of this disorder. Why are you getting diabetes? Why do you have hypothyroidism? Why do you have a mood disorder? Is it the nutritional deficiencies that you have that is driving this? Is it the lifestyle that's driving this? Is it the gut microbiota? So understanding the why and how is functional medicine. And we use many tools to get to the answers. But systems, understanding that everything is a system. We're a part of a system. Suppose you have a myocardial infarction, right, Dr. Lakshmi? So just saying that you have a block in your vessels that's caused your heart attack is not enough. Why do you have that block? Where is the inflammation being driven from? Everything. Your kidneys are connected to your heart is connected to your gut, it's connected to your brain. So
you're just looking at the overall
yes,
overall thing and not just as an individual thing, and understanding why it is happening.
That's right. So we are looking at everything as an interconnection. Even the friends that you have, if your friends are drinking every Friday, and if you have one set of friends who are going out for a walk every Sunday morning, that's going to change your lifestyle, and that's as part of your system too. So everything is interconnected. So we're looking at it as a systems biology. So that's what that means. And then personalized and precision based. So each individual responds differently to the treatment, right? Not just the treatment, but also the environmental conditions we are living in. Not everybody that's exposed to mold will have mold toxicity.
Correct.
Not everybody who's drinking those 3 Cokes every day will have a heart attack.
Correct.
So looking at it individually, understanding the side effects of the medications also, and personalizing your treatment, that's what is functional medicine.
So basically understanding why this is happening to somebody and what is the root cause. Am I right?
That's right. That's exactly right. And I think any good physician is doing that, right? But what differentiates a functional medicine practitioner who is looking in that functional medicine lens is probably the mindset. As conventional medicine practitioners, we have probably, excelled in acute care.
Correct.
Right? If you have a stroke, within that 15 minutes, what to do? Everything, we've excelled. But to prevent that stroke from happening, to change that mindset from, bandage, from the fire that has already started to extinguish it, but to not start the fire, to go back downstream into the causes. I think that's what changes your conventional lens and a functional medicine lens.
So when do you think one should see you? Is it once the disease is diagnosed, or is it before that? I mean, what's the right approach?
So I think that's a very interesting question, because we are looking at going downstream, not upstream, right? So when do we come to a functional medicine practitioner? I think whenever you get to see your physician, right? Is it that you are looking for health as your goal? Then you come in early on, then you get your health checkups, extensive testing, depending on your health goals again. Then a patient who's already been diagnosed with diabetes, they can also come in. So it's not when, it's how the patient wants to be approached. Are they ready to look at their health as more than just a disease that needs medication? When they understand and want to understand the root causes, when they want to change their lifestyle, their mindset, when they want to work with a practitioner who's empathetic and sympathetic about the various factors that are affecting their health, I think that's when. So any time is the right time, I feel like.
So, doctor, what can a patient expect when they are seeing a functional medicine physician?
So I think taking the time out to come and approach a physician, that's very important, because we are going to start with a set of tools that we have. That starts with the patient's story, the patient's health codes, the patient's symptoms, the patient's lifestyle questionnaires. So we have X number of questionnaires that we want them to fill up to understand where their health is, right? So a patient might be concerned that they have vitamin B12 deficiency and fatigue. But are they going to tell me that they have bloating, that they have intestinal disturbances that is affecting their absorption? No. So probably filling out that questionnaire that shows us, what symptoms you have, that gives us an inkling even before we meet them that they have these systems that are affected, can help us. So we need them to spend that time filling up their questionnaires, and that time to come and spend with us to tell their story from the beginning, from their birth history, from their family history, that's going to influence their health right now, from their childhood history. So we do all that, and then we map their matrix to understand where they are right now. Then we move on to the next level, that is testing, extensive evidence-based testing. Suppose it's a patient who has metabolic syndrome. We look at their advanced lipid profile. We look at their inflammatory markers. We look at uric acid. We look at simple tests, but also extensive tests if they're ready to do it. Not that everybody is going to be tested. We can work around that also. Do we need to test their genetics? Do we need to test their gut microbiota? So we need to understand that. So we need that time for the patient to spend with us, and we need to understand their health goals also. So after the health testing, after the testing is done, then we have to come up with a personalized plan, right? So it's personalized and tailor-made to that particular person.
So every patient is different, and it's not the same
Yes.
treatment or same plan
Yes.
which works for everybody.
And also collaboration, right? It's important to meet a physician who is a functional medicine practitioner, because we need to understand that there are some red flags that we have to refer to a super specialist, right? Suppose there is a case of an IBS. Is it a case of IBS? A lot of people self-diagnose and come that they have irritable bowel syndrome. And then we work in collaboration with a nutritionist, with a counselor, a psychiatrist if needed, then a super specialist, rheumatologist, gastroenterologist, neurologist, whoever it is, and an exercise therapist. It could be a physiotherapist, it could be your gym trainer, whoever it is that you're already comfortable with. So I think it takes a team effort for chronic disorders to be addressed.
How are patients with chronic disorders would be beneficial if they visit a functional physician?
Chronic disorders, any disorder that you're living your life day in and day out with that disorder. It could be something like I've already mentioned, irritable bowel syndrome. It could be a mood disorder. It could be anxiety. It could be any metabolic disorder like hypertension, diabetes, obesity, right? Anything that you're living day in and day out with. It could be hypothyroidism. Could be driven by the nutritional deficiencies. It could be driven by an autoimmune condition like Hashimoto's. Are we understanding the cause, or just taking thyroid supplements? So anything that is affecting you day in and day out to perform your daily activities, which has not been addressed by taking a short course of medication is a chronic disorder.
So basically, you are not just treating the symptoms, but you are treating why it has happened to the person.
Yes. And we understand that it is one condition can present as multiple disorders, and multiple disorders can drive one condition too. So we understand that it's far more complex and it's not as simple as.
So, doctor, I mean, as a functional medicine physician, I'm sure you must have made a lot of changes in your personal life as well.
Yeah.
Right. So, what is that one habit you think has made a major change? Is there any one tip off that you could give us?
I think there are many changes that you make when you read about and when you're aware about and when you see people's lives changing based on those interventions. But I think mindfulness is something that has changed my life significantly. Yeah, exercise has helped, diet has helped, but it's probably the mindfulness. Getting up in the morning every day and mindfully noting down what I want to accomplish that day, probably in that week, to just sit with my thoughts, to have that mindfulness, to be present in the moment, not just in my work life, but in my personal life. That's something that has changed my life, I feel like. Especially for people with chronic disorders, to have that mental, emotional, and spiritual balance is very, very important. And that should come. It comes with practice, but it also should be encouraged by us as practitioners. And that's something that I've changed in my life, and that's done me a lot of good.
That's really wonderful because most of us tend to say, diet, exercise, sleep, but mindfulness is something I haven't heard anyone say.
No, because most of the chronic disorders are stress driven.
Correct.
If you haven't noticed, most of this is driven by the stress that we live in, the daily expectations, the social media expectations that we see and expect from ourselves. So I think the mindfulness, the practices that we can put in very easily, and just downloading an app like Calm app and sitting with your thoughts for 2 minutes can help. So I think that's the most important, impactful lifestyle change that I have done.
So as a functional medicine physician, I'm sure now you understand why something is happening to anyone. So what are some causes at the root level you think we could prevent or we could make a change and have a healthier life?
As a functional medicine practitioner, I've seen many cases, but I can't say I understand everything. Sometimes you look deep and you still can't find the answers. But I feel like the lifestyle changes that we make, right? Like I've said, the diet, the exercise, the stress, the counseling that puts in, that does give a lot of benefit to these patients because it's the whole mindset shift, be it chronic fatigue syndrome, be it IBS, be it metabolic weight disorders, obesity. I think that lifestyle interventions, that I think is the bottom of the matrix that we need to change. And that has provided the most impact in chronic disorders.
And by lifestyle interventions, I'm sure diet plays a major part of it. So are there any superfoods or what is the perfect diet like?
So there's nothing like a superfood, right? So in functional medicine, we have different kinds of diets that have been tailor-made to particular, probably subsets of patients. If an individual comes in who has zero control of what he's eating or she's eating. Okay, they have a lot of sugar, a lot of processed food, and they have eating out every day almost. They have all that. So we don't start with an intervention that's more complex. We start with a core food plan where we remove these processed food. We slowly cut down on their sugar. So we're not suddenly changing anything for them. We try to bring in organic foods. We try to change it slowly, right? Then if there's a patient who has diabetes or who has dyslipidemias, that is their cholesterols are up and down, even somebody with insulin resistance or PCOD, then we probably put in a cardiometabolic diet plan where it's like a modified Mediterranean diet plan. So modified Mediterranean diet plan will have a lot of low glycemic index foods. It'll probably have a lot of omega-3 fats, rich foods. And we cut down on the processed food. So we give that to a patient who has metabolic syndrome. If there's a patient who's suffering from IBS, We probably start with an elimination diet, simply eliminating foods that cause these irritations. If that's not working, then we have a low FODMAPs diet. If there's a patient who has a lot of fungal infections, like a lot of oral thrush and vaginal candidiasis, then we go in for an anti-candida diet. So, and if there's a patient who has a lot of fatigue, then they have autoimmune disorders, they have CFS, then we probably go in for a Mito food plan, where there's a lot of ketogenic foods good healthy fats that we put in, along with superfoods like you mentioned, that have a lot of coenzyme Q10, that have a lot of magnesium. So all these things, or omega-3 fatty acids. So all these are very tailor-made to the subset of a patient. So you can't say that one superfood is going to cure all. And I think I'm not the right person. I will give you a prescription and you have to go to a nutritionist who understands the details of all this and give you a prescription for that. So we need to work in collaboration.
So it's tailor-made, personalized, and it's not like, a general plan for everybody.
Exactly. You've put it beautifully.
So if there's one hack for wellness that you could put it on a billboard, what would that be?
Oh my God. Probably taking responsibility for your health, not giving excuses. So taking your health into your hands, meeting the right practitioners, asking for help when needed. So I think taking your health into your hands is the wellness goal.
Beautiful, Dr. Sudeepta. So there's one thing that I've been dying to ask you. What made you choose functional medicine? I mean, being a conventional physician, I don't know if it was a hard choice or was it out of passion or was it something that you wanted to do?
So like I said, I've always been passionate about being a physician. And I was constantly seeing patients, especially chronic cases, who would come in. Their sugars were not under control. I would give them medicines. I would see their blood markers. They would come back a few months later with, either control or then uncontrolled, then given some more medicines and send them back. And then they would end up with complications, right? They would end up with strokes, despite whatever we are doing. They would end up with heart attacks. They would end up with, neuropathies, and their life would be miserable. So I felt like I wasn't changing anything. I was just putting Band-Aids all over is what I felt, just giving them pills wasn't enough.
I realized treating the symptoms.
Temporarily treating the symptoms wasn't giving me the satisfaction that I was looking for. So I wanted to ask the questions and see, can we do something further? And then I came across this course, functional medicine. I said, okay, let me give it a try. They're looking at root causes. They're saying that it's going to help my chronic disorder patients. So I did one module. I said, most of my cases are cardiometabolic, so I'll do that one module. Then I understood that it's far more complex than just understanding the cardiometabolic.
Was that a game changer?
It was, because when I went through that course, I knew that hormones are going to change your cardiometabolic outcomes. I knew that the gut microbiota can change the hormones, which in turn can change your inflammation. So it was so complex and I wanted to learn more. So then I finished all my modules, 6 modules. Then I finished my case reports and my exam. In 1.5 years, I was done with my certification and I was ready to come on and meet the world with a function.
Yet simple, probably.
I don't think it's simple, but we should be getting there soon. Yeah.
How does your refrigerator at home look like? I think that's an interesting question for us.
My refrigerator at home looks like any refrigerator. I have children. So there is a little bit of everything in there. But we tend to drive towards foods that are more organic. We have a mix of everything. Colors, it's colorful. A lot of fruits, a lot of vegetables. And no sugary drinks at all. So we drink water. And so I think it's like any other refrigerator. Just little changes here and there.
So, Dr. Sudeepta, functional medicine being a very relatively new subject, okay? So, do you think there's enough awareness about this among people?
Functional medicine, Dr. Lakshmi, is not new. It's been around for more than 30 years. I think the buzzword now is functional medicine because there are more non-communicable diseases, right? Chronic disorders have taken over acute disorders or infectious disorders.
Undoubtedly.
So every other person has a chronic disorder. So I think they want to understand, the patients now, the people now want to be aware. Why is this happening to me? Can I do something to stop this from happening to me? My father had this at 40 years of age. Can I stop this from happening to me? So now the awareness is much more. So functional medicine is not new. I think medicine per se is functional medicine, but it's the awareness that's changed the game. It's the patients, it's the people that have driven functional medicine practitioners to take this up and to reach out to them. So I think awareness wise, it's already there. It's more people that have to take it up to change this medicine game, to change our mindset. You don't need probably a certification or anything. Just to change our mindset and say that we are going to be more empathetic. We are going to understand the why and how. We're going to go back to our first and second years of pathophysiology and tie it up with our treatment. That's all that matters, I think.
And finally, Dr. Sudeepta, if there is one message, that people want to take away from this conversation, what is that final message you would like to share with the audience out there?
Health and disease are not a separate entity. They're a continuum, and we should start thinking downstream. We should start making the changes from the beginning. So that, I think, is my final message, that health is a continuum and we have to take it into our own hands.
Thank you, Doctor. It was wonderful interacting with you today.
Thank you so much, Dr. Lakshmi, for taking the time.
So this brings us to the end of this episode. Hope this episode was informative and valuable, and don't forget to tune in next week as well. Until then, take care and stay healthy. Thank you.